Hi, it's Dr. Mimi Guarneri, and we're at Pacific Pearl, La Jolla. For those of you who are looking to come in for your appointments, please just call the office. You have two options. First one is you can have an in-person appointment, but we will be checking your temp at the door, and you will be assigned a face mask if you don't have one. Second is if you want to have a consult or an appointment by phone, just give a call to the front desk, 858-459-6919, and we will get you scheduled. So this is the latest and the greatest, and you have to remember everything is changing every day. We have been doing antibody testing as part of a research study. This is your antibody testing lecture 101. So when you first have an infection, when your body sees an infection, the immune system responds. Part of that response is the febrile response, the fact that you get a fever, the cough to clear virus, and so on. But what the immune system does is it produces an antibody called IgM. Remember M as the first one. That antibody tells us you have an early infection, and it doesn't matter if it's COVID-19 or it's Epstein-Barr or it's herpes. Early response is IgM. Later response over time is the body converts the IgM to IgG. IgG means I have had an old infection. So what are we seeing with our antibody testing? We have done over 40 patients right now at Pacific Pearl, and what we're seeing is actually people that were ill in December with an undisclosed illness. Gee, I had shortness of breath, cough, the worst bronchitis of my life. I had flu, even though I had a flu vaccine. We are seeing many of those people coming back positive for COVID IgG, meaning they had the infection and now they've recovered from the infection. The good news is those individuals may be able to donate their blood, and their IgG can be used in immunoglobulin serum to help someone else who's not as fortunate and is hospitalized. We are also seeing many people have what's called IgM, the early antibody. Now, some people have IgM and they're completely asymptomatic, and they say, Dr. G, I don't remember having this, I don't have anything like this. There is a small possibility they are having a reaction to a different coronavirus. There is that small possibility. Some people are completely asymptomatic. And then we have people who have IgM, early antibody, and they are symptomatic. They're coughing, they've had low-grade fever, they have body aches, they have muscle aches. So what we've done at Pacific Pearl with our entire team, putting our head together of integrative specialists, cardiologists, internal medicine, naturopathic medicine, the whole team, traditional Chinese medicine, came together to put together a 5-pronged approach to treatment. If you are looking just to prevent this virus, then we have a separate antiviral package. We have treated approximately 10 people right now for COVID-19 using our herbal support and tinctures, our antiviral tinctures. I'm not saying we're curing COVID-19. I want to be clear. What I am saying is we're giving your immune system the tools it needs to fight this virus. So whether you want to do full prevention, or you're having symptoms, or you're in the full recovery phase, we've designed protocols that fit what individuals need. And I want you to remember this. We always talk about the soil. How do we keep our soil healthy, which is what keeps our immune system healthy? That means a good night's sleep, getting out in the sun. That means having joy and laughter and connecting to people in any way possible. It means eating lots of green leafy vegetables and dark fruits and berries. So it's a multi-pronged approach. It's nutrition, it's nutraceuticals, it's sleep, it's drinking plenty of water. You must stay hydrated. And it's looking at where am I at emotionally, mentally, and spiritually. And I'm so glad that Rowney King, our executive director and our Healing Touch Extraordinaire instructor, has put together daily affirmations, which hundreds of you have signed up for. And I want you to take those affirmations and I want you to actually use them. Yesterday I looked at the affirmation and I kept walking around going, I am strong, I am strong. I'm sending a message to my subconscious. I am strong, I am healthy, I am whole, I am healed. That's the kind of message I want you to be putting to your subconscious, not the negative. We'll be back again with another update. Stay well and stay home.